whenever a kid is having some nosebleed, it looks quite alarming, distressing, even anxiety provoking. But is every nosebleed serious? Do you always have to run to emergency, or is it not quite so? Let's figure it out. Hi, I am Dr. Agnisekhar Saha. I am a consultant pediatrician and pediatric intensivist working at Apollo Hospital, Kolkata. So, nosebleed in kids is surprisingly common. About 30% of kids less than 5 years will have some nosebleed. More than 50% of older kids will have some nosebleed at some point of the time, 6 to 10 years. But what is reassuring is most of them, an overwhelming majority of them, are benign. They are not serious, right? What is the most important cause of nose bleeding? And you'll be surprised to know that it is trauma. Okay, and what is the commonest form of trauma? It is nose picking. Yes, they do pick their nose, and sometimes that itself may be enough to cause a nosebleed, although it sounds surprising, but it is true. So when a kid is having a nosebleed, let us first figure out what are the signs which tells me that it may not be a simple one, it may not be a trivial one, and you may need to do something about it. So what are the red flag signs for a nosebleed? One, if the kid is less than 2 years old, then usually it is some form of trauma or something serious, and often there may be some sort of hidden injury involved. So that is one. Number two, if it is causing some difficulty in breathing, then you need to go to an emergency straight away. Number three, if it is happening after some surgery in your nose, in the kid's nose, or the kid is having some sort of tumor in the nose and he is bleeding. Number four, if this bleeding is associated with bleeding from somewhere else or some easy bruising. These are primarily the thing, and sometimes if the nosebleed is so severe that it is making the child pale and he is becoming fatigued, then also you need to come to the A&E straight away, although that happens very, very rarely. So if you can exclude all of these things, then the most common cause is what we call an anterior nosebleed, and these are usually self-limiting. So what to do? Number one, do not panic. Okay. Number two, ask the kid, if in an older kid, ask them to blow the nose first. Okay, because if there is any blood clot, then that should come out. Sometimes that may make the bleeding initially worse, but that is fine. Okay, so ask them to blow out in older kids. In smaller kids, of course, they cannot do it. And once you have done that, then number three, make sure that the kid does not lie down or does not lean back. On the other hand, the kid should be up straight and leaning forward like this. Okay, leaning forward so that the blood does not go back to the throat. Okay, and then what you need to do is press the soft part of the nose. Press the soft part of the nose, so these two parts, with both the fingers. Even if the bleeding is happening only from one side, you still have to press both the sides, and then keep it pressed for 5 minutes. And this 5 minutes must be according to the clock. When you are doing it, even 2 minutes seems eternal. So you do it by the clock and keep it pressed for at least 5 minutes, anything between 5 to 10 minutes. While doing so, you can also apply some ice or some cold pack over the bridge of the nose. This is the bridge of the nose. You can also do that. And what is most important is this should be not intermittent. So for this 5 to 7 minutes, you should keep pressing. You should not release the pressure. That is what is the most common mistake. And of course, the kid should continue to breathe through the mouth. And if you keep doing it and then release it after 7 minutes and see what is happening with the bleeding. And if it is still continuing, then you can continue this, you can repeat the cycle. Altogether, you should, if it does not stop even after 30 minutes of total pressing, then that is the time when you should go to the hospital. But believe me, that happens very rarely. Most of the nosebleeds are simple, they can be taken care of at home. But if you have any of those red signs, then please come to a hospital. We are there to help you out. Thank you.